talking about here. And so today we're going to have a discussion so that you viewing this video will get a better understanding of what the device is, the innovation behind it, the science behind it, the research, as well as some small clinical, I guess you can call them, trials with it to confirm the efficacy of it. And our goal here is to provide this information to the manufacturing community, the medical device, the pharmaceutical industry, in search of a licensing partner. Now, Eli has developed the product. It has been produced in a very limited quantity so that it can be touched and felt and seen and actually used. So with that, let me just turn it over. Why don't we start, Eli? Why don't you give your introduction about yourself and background, which led to you developing this IP, or why you developed this IP?
Sounds great, Rand. Thanks for interviewing me today. I'm essentially an academic physician by trade. I'm trained in gastroenterology, internal medicine, and clinical pharmacology. And I've been doing research, education, invention, and development of new ideas for more than 30 years. I've worked at some of the top academic institutions around the country. And my job has been, besides taking care of patients, to do research and to train other physicians how to be doctors. It's been a great career, but along the way, I've focused on inventing. I have several patents. The most recent one is for this device, Bocaliner. I came across this.
Show it.
Sure,
let's take a look at it.
Here's an example of a standard size Bocaliner device. And we'll go into more detail about what's entailed. Looks simple. There's actually a fair amount of engineering that's gone into this. And it's been designed specifically for comfort and to accomplish what we're doing pharmacokinetically with this device. And that's the standard size. Here's the small one. It turns out some people have smaller mouths and they tolerate a smaller device better. So according to my background in clinical pharmacology, we think of drugs going into compartments. So for example, if a drug is given intravenously, it goes into a large compartment, which consists of the circulatory volume. So it's going into 6-8 liters when you first inject the drug or when it's first given intravenously. When you're giving medicines to treat inside problems that are inside of the mouth, that's a topical therapy that's supposed to stay in the mouth and do its job. The problem with the mouth is, number one, it's a very small compartment compared to the circulation. And number two, things don't stay in there. The mouth has been designed specifically to remove things from inside of the mouth rather than keep them inside of the mouth. And the problem is, if you're giving a medication like a gel or a mouthwash, you're wanting what stays in the mouth to take care of local problems. And when I say local problems, I'm talking about mouth sores, dry mouth, oral pain, problems with the teeth. All of those things that you give directly into the mouth are quickly removed. The reason for that is the mouth, inside of the mouth, these medicines get quickly diluted. The mouth is constantly in motion because of the muscles that make up that compartment. And then everything is pushed down and swallowed. So if you're giving a medicine, for example, for a patient with a painful ulcer in their mouth, and you're having them swish it around in their mouth and spit it out, you want the medicine that stays to work on the pain. Problem is, it won't stay because it's being rapidly eliminated. So that's why that was the purpose of developing Bocaliner, to help to improve oral topical therapies and sublingual therapies.